So I'm Dr. Raymond Douglas, and today is a really special guest of mine who's going to share her story. And Bella, I'm going to let you introduce yourself and how we got to meet some time ago. And I'm going to also let your mom kind of interject too, as far as how we got to meet. But it's so nice that you are coming online to share your story, a little bit about many of the things you've gone through. So thank you so much, Bella.
Thank you.
Mm.
My name is Bella Wells, and I'm 13 years old, and I have Graves' disease and thyroid disease.
Okay. And I know it's been a while since you've been diagnosed and we met, but tell me a little bit about some of the things that you were going through when you were first diagnosed with Graves' disease.
I was really over emotional, and I had a lot of anxiety attacks, and I lost a lot of weight before I found out.
Yeah. And what happened to your eyes over that period of time?
They started getting swollen, and I realized that I looked tired all the time, and I just looked different throughout the day. It was really weird.
Yeah. And I know your mom was the first one who reached out to me, and thank you very much. Tell us a little bit. I'll let you introduce yourself, but tell us a little bit about what was going on at this time. It was a pretty tough time for you, and I'm sure the whole family.
It was. I'm Sheree, Bella's mom, and probably, what she said, she was emotional. That's an understatement, I would think. But because of her age, we didn't think much about it. She got sick. We thought she had a stomach virus, and within a week, she had lost 12 pounds. She ended up at Vanderbilt after some blood work, and we really started from there. About 6 months of just treating her thyroid. At that point, she had no visible symptoms with her eyes, and nothing that she truly complained about. But we went through beta blockers and methimazole, IV steroids, and probably 6 months in,
Yeah.
she began to complain of eye pain, seeing double, just pressure, and she did look swollen and like she had not been sleeping around her eyes. And then that's when we ended up at a ophthalmologist. That was sort of the beginning stages.
Yeah. So then when and I really love hearing your story, because I get countless emails about people kind of struggling through the early stages, and really, it really is an inspiration. I know, letting people know that just your journey, and so I really appreciate you filling us in on all those details. And so when you went to the ophthalmologist and you started to notice these eye changes, did it start to help or improve things? I know things got worse, but what did you find as far as that was beneficial, for other people to know, maybe that helped to improve the eye symptoms, or that kind of got you through those early stages?
What do you think?
I think early on, they really didn't know how to treat her because of her age and the severity. She slept with eye masks. She did eye drops throughout the day, ointment in the evening.
I had to do eye drops during school a lot. I had to leave classes and stuff.
Yeah. She did bromonidine drops for the glaucoma. Ibuprofen. They tried to do steroids for just the discomfort because it was a lot of pressure.
Yeah.
She did 6 weeks of that and didn't get a lot of relief with the IV steroids. And then we attempted the methotrexate for 8 weeks and the ophthalmologist didn't see any changes, from her perspective. And then we did proton radiation.
Yeah. And your eyes were pretty significantly bulgy, much more than they are now. It's a big difference, and we'll show some photos and such if you allow. But how did it impair school? I mean, I can't imagine, it's hard enough being 12, 13 years old, much less being 12, 13 years old and having this disease where you have to take beta blockers and then have all these changes. How did you cope? I mean, couldn't have been easy. That's a question for both of you, because I know that this is not just just doesn't impact one person, it affects the whole family.
You just got to look at the positive sides of it, and you can't focus on the negative, and that just know that you'll get through it no matter what. Like, there's always a good side to everything, and that's just how I got through it.
Yeah.
Yeah.
How'd you get through it, Mom?
I think she probably hid a lot. She was very protective at school, but it would come like the self-esteem issues. Sports were affected. There was a lot of things affected, but I don't think she really displayed it at school. And so at home, we caught most of it.
Yeah.
She was really withdrawn. She did not want to go anywhere. She didn't want to do anything.
Yeah.
Didn't read books.
Well, I know, and I still remember the photo we took, before your surgery. And so tell me a little bit about what the surgery was like for you. You had a decompression surgery on both sides, and pretty brave girl to go through all that at such a young age. I don't normally have to, as I've told you, and I'll tell everyone else, I don't normally operate on people quite so young because the disease normally isn't nearly as bad as yours. But you couldn't close your eyes, you couldn't function. It was really bad. So we had to really do something. So tell me a little bit about how you made it through surgery so easily. You just kind of breezed right through in so many ways.
I feel like I should have been nervous, but honestly, I felt like I've been waiting to do this forever, and I wasn't really nervous because I've been waiting for it, and it was such a sigh of relief to get it done.
Yeah. And you did really well. Absolutely. And then, how has your recovery been since the surgery? You did really well. It was just the one phase that, no real consequences as far as double vision, but how have you been functioning and doing since then?
My eyes have healed really well. Like, I have barely any problems at all. Just a little bit with vision, but that's it. Nothing really else.
Good. And I know you're kind of re-engaging in school and other things, so that's really kind of the most exciting part, is that kind of getting your life back. At least I see on social media you are. So I wanted to take a little transition here and talk a little bit about how you went through this disease and then came out and really became someone who makes changes in life for other people, and a little bit about how you started your 5K for thyroid awareness, because that's a pretty special thing. Someone who goes through this disease and then wants to give back to others and raise the awareness. Tell me a little bit about what made you want to do that and how you put it together. Or would like to continue that process of giving back to others, and you're a great example of that.
I felt like I should really give back, considering all the support that I've gotten, and I just felt like I should raise money and help set awareness for this disease, because there's not really that much awareness going on about it, and I just felt like I should do something.
Yeah. And I know you had a little bit of trouble doing a little run. How did that inspire you when you became a little frustrated? And I guess anytime you become frustrated, you put your mind to overcoming that frustration. Tell everyone that's a pretty cool story, I think.
I used to be able to run 5Ks really easily. I used to do it a lot. And then it had been a while since I got sick, since I ran one. And so my mom signed me and Dad up for one. And we went, and I could not finish it. and I got so mad. And when I got mad, I said a few things, and then Mom came up with the idea, like,
We should ask why they had their name on the shirt. The Big Brothers, Big Sisters.
oh yeah, I did. And Mom had said maybe we should do something, and I said, why not do a 5K or something to help?
Yeah, so tell me a little bit how it went. I mean, you had an amazing turnout, raised money for the awareness. How did you organize it? I mean, you know, you just don't, you know, open the door for a 5K. It's pretty amazing.
It was a lot of hard work, and there's a lot of times I did not want to do it. But you know, you just got to do it because we had already
every day.
Yeah, we had already started it, and might as well finish it. So yeah.
I know that
Or not be as hard.
Say that one more time, Sherry.
We hope next year will not be as hard as this year was.
Well, we're certainly looking to help and hoping you can inspire us to do one in Los Angeles and be our poster girl for doing that too, and catch on. I know the Graves' Disease and Thyroid Foundation really was a great participant and help and, you know, advertising things. And then, you know, and you raised an amazing amount of money that you're going to give for other people to try to, you know, improve their condition and get treatment too. Tell us a little bit about all your sponsors and your goal.
My goal was to raise a lot of money, and I didn't expect so many sponsors to help out. I was just really amazed that so many people came and donated and did all the stuff and helped me out. I couldn't have done it without them.
Yeah. Cool. And you raised $5,000 for, you know, for more awareness and improving things. And you know, I'm a huge believer in philanthropy. We started a program, you know, many years ago, and I know you are too. And I think that that's awesome to give back, and it really gives people an ability to take control of their own health and destiny. So I really appreciate you doing that, and I know that we'll work together and hopefully make even bigger next year and expand to Los Angeles next year.
Thank you. She would love that.
Yeah. Well, you're the guest of honor in the little parade. You can lead the traffic. Well, as we begin to kind of sum things up, Bella, what can you offer for people who are relatively newly diagnosed? Again, I get a lot of, you know, people that are just frustrated with this whole process. I'm going to give you and your mom a chance to have like a final word of if your friends came or a best friend came and said, what can I do to get through this disease process? What kind of advice can you offer based upon what you've been through?
Just research and do all you can to find out new stuff and figure out what to do, and just have faith that it's going to work out good and that everything's done for a reason. So.
Well, you sure are a great role model for that, Mom. And you know, any specific words of advice for people who have this or other family members? I mean, you know, whether that be spouses or parents of younger people.
I think, like Bella said, we probably got every book that we could locate on the condition. We didn't have a local group here for support, so we found some online groups, and the Graves' Disease Foundation was the first group that we joined. And I think just that networking, because from them we found you. We've had a lot of networking, and I think, like Bella said, she would keep notes on things that she read, new treatments, you know, different things that worked. I mean, she would have a little notebook and she would just keep tabs on everything. And I think for family to, in our house, it was really expect the unexpected from her. I mean, because it was moment to moment, day to day. It may be a good day, it may be a bad day. And most days I don't think she knew what it was going to bring. I mean, honestly, a
Yeah.
lot of patients, and if you don't feel comfortable with the doctors that you see, or you just don't, I don't know, for us, I didn't have that peace, you know, when we talked to different people and they weren't comfortable, especially with her age. And we probably burnt some bridges, you know, moving between doctors. But once we all got that, you know, it's like we knew that we were in the best hands when we found you.
Oh, thank you.
And I think I mean, it was a long journey.
Well, it's pretty tough, and you're pretty amazing for doing it. You know, and I run a fellowship where I train other doctors. So you're going to be ready in about 10, 15 years to take over for me?
Yes, yeah.
All right. Well, we can start with your shadowing and internship anytime you're ready. So you let me know. Well, thank you so much for sharing your story, both of you. I know it's just really important for so many people, and I really appreciate you being so candid and honest and telling us about everything.
Thank you.
Thank you.